Hello everyone, the antenatal class is still ongoing, and today I want to talk about hygiene in pregnancy. Hygiene in pregnancy is just a normal hygiene, but just that in pregnancy, your hygiene level, if it have been 60%, you advise you take it up to 80% because you need to be hygienic in so many areas because any infection causes trouble to you more and to your child. That's why we are saying step up on your hygiene. And there are some tips. I'm not going detail because I believe it's a very common topic, but there are some tips that will help you. Apart from bathing twice daily, because as a pregnant woman, you sweat more. So we advise that you bath twice daily. It's better. And another one is brushing twice daily. And where I'm coming from is my point now is every of your meal, just ensure that you rinse your mouth thoroughly. After taking any meal, rinse your mouth thoroughly because there are cases of gingivitis and tooth decay is common in pregnancy. And because of how people are so conscious of how to the type of drug to use for you, they may not be able to use all the medication for you. So it is better you prevent it than having a particular disease that will now say, the doctor will now be say this drug is not okay for you, it's not good for a pregnant woman. It's better you prevent it. So that's why I say step up. If your hygiene is 80, take it to 90. If it's 60%, take it to 80%. Another area that's very, very important is that there are some areas that you need to pay more attention, like folds. There are some folds, like under your breast, you need to lift it up, wash it more there. And your armpits, pay more attention there. In between your buttocks, pay more attention there. In between your laps, pay more attention there because microorganism tends to be there more because they hide over there. But if you don't give attention to these areas and you are sweating more, it causes more issues to you, and we don't want that. So these are the tips that can help you. Another one is maturation, that is urination. Whenever you urinate, I just urinate. It's not about you defecated or you poo or you use the toilet to defecate. No, when you urinate, I mean urinate as in you went there to pass urine. If you're at home, it is advisable you have a very clean towel in your bedroom, very clean towel that you know you wash it every time. Whenever you go to bedroom, use water, wash it off, and use your clean towel and clean up. If you're outside, always go with your tissue paper. Immediately you are done, you wipe from front to back. As I said earlier on the first topic on this antenatal classes, that there are changes that occurs in your urinary system. When there's an infection, when it traps up, there are a lot of things you are more prone to have some infection known as UTI, urinary tract infection. So we don't want that for you. We don't want it. We don't want microorganism to start traveling up because while it goes up, it causes more harm than good. So prevention is better than cure. The last on this hygiene in pregnancy is your surrounding. Normally, this is not just about you, but the reason why you want to want to talk more about it is that if your surroundings are not well kept, isolated, there will be a malaria infestation. Mosquitoes will be filled up that place. It will come and infect you. And malaria in pregnancy, it's not a good one. It can lead to anemia in pregnancy. No, it's not good for you. And also cholera. So when the surrounding, you can be infected with cholera because the surroundings are not well kept. So if your surroundings are well kept, mosquito is far from you, you will not be bitten by a mosquito, and mosquito will not see you, and you will not see mosquito. Malaria will be far from you, and if malaria is far from you, anemia will be far from you, and the complication of anemia, which even can cause a lot of things. It can even take a woman's life because when you don't have blood, what else? When you don't have enough blood in your system, there are no complications. You might lose your child. So this rough road is the way road that we want to avoid. You may say hygienic pregnancy is a common topic. It is not common because the problem that may result from you not imbibing in it may be far, far beyond your imagination. So, with this point of mine, I think I'll be able to convince you and not to confuse you that you should step up in your hygiene level. Let it be green. Green is 80% to 100%. Take it up there. And we do. Thank you for today.